with fruits and with vegetable all the way.
A very good morning to you. That will welcome you to Glow Health Talk with NMA, Nigerian Medical Association, Ondo State Chapter. This is where we'll talk about health. Remember, health as well. So we're trying to garner all the wealth in the world. You are trying to do one or two things, ensure that your health is in check, and that's the essence of this program, the essence of the partnership with Nigerian Medical Association and Glow FM. Today we have a topic of discuss. Every Saturday morning we'll come here with different topics that pertains to human beings, things that we can relate to, and we bring in a guest who knows his our onions well, and today is not an exception. We're looking at the topic, reducing the burden of chronic kidney disease. Reducing the burden of chronic kidney disease. These and other things surrounding kidney disease are what we'll be looking at on the program this morning. And it's a pleasure joining us on the program this morning, consultant, nephrologist, Federal Medical Center, OWO, Dr. Olalekan Ojo. Glad to have you on the program this morning, sir.
Good morning, presenter. Good morning, our listeners at home. It is my pleasure to represent my association as we partner together to advance health in Ondo State and Nigeria in general. Thank you very much.
Ashungani, I like that. My name is Comfort Omolafe, of course, your regular anchor on the program. We're gonna short break now. When we return, the program continues. Remember, this is a mixed grill. We have it in Yoruba and English. So for those at home, sorry Sheba Ekoto data me now. Ekabo sorry to Itoyin Ilera Loro pẹ̀lú ìbáṣepọ̀ Nigerian Medical Association ti ìpínlẹ̀ Ondo ń bí. Lónìí à ń wo bá ṣe lè dínkù wàhálà lórí kidney disease àti gbogbo nǹkan tó surround reducing the burden of chronic kidney disease. Òun náà la fẹ́ mẹ́nubà lónìí. A dẹ̀ ti rí ẹni tó dáńtọ́ dáadáa tó wá sórí ètò lónìí tó máa bá wa yànnà iná ẹ̀ ní ẹ̀kọ̀ọ̀kan tí a fi yé wa dáadáa. Àwọn náà ni consultant nephrologist ti Federal Medical Center wọ àwọn ni Dr. Olalekan Ojo. Lẹ́ẹ̀kan sí ẹ káàbọ̀ sórí ètò wa.
Lẹ́ẹ̀kan sí ẹ ṣé olóòtú. Mo sì kí àwọn ènìyàn wa nínú ilé pé ẹ kú ìgbádùn òpin ọ̀sẹ̀. Ó jẹ́ ìdùnnú mi láti wà lórí ètò lónìí láti ṣe aṣojú fún ẹgbẹ́ onímọ̀ ìṣègùn láti sọ lónìí láti sọ̀rọ̀ lórí àìsàn kíndìnrín.
Ẹ ṣeun gan. Ẹ tún mú lè darapọ̀ mọ́ wa lórí Facebook, ìyẹn ni Glow 99.1 FM Àkúrẹ́ lórí Facebook. Ẹ dẹ̀ tún lè gbọ́ wa lórí Radio Garden tàbí wẹ́bsáìtì wa www.glow99.1 FM, ìyẹn lórí wẹ́bsáìtì. Ibikíbi tí a bá wà lágbàáyé náà lẹ ti lè gbọ́ wa. Ẹ já dátà mi nẹ̀, má yí kúrò mẹ́. Glow Health Talk with NMA, and today we are looking at the topic reducing the burden of chronic kidney disease. Very quickly, Dr. Olalekan Ojo, what exactly or how do we define kidney?
Thank you very much, the moderator. The kidneys are very essential life-saving organs in the body, and in most people, there are two, and they are located on the lower back of the human being, one on either side, and they're about the size of the human fist. And like I said, they are life-saving organs, majorly filtrative, and God just made it to be there. And they serve very different, important functions for life and living.
Eshumgane dókítà wa tí mo bèrè lọ́wọ́ lédè Gẹ̀ẹ́sì lẹ́ẹ̀kan fún àǹfààní àwọn ará ilé, mo fẹ́ kẹ́ ṣàlàyé lédè abínibí wa kí ni kíndìnrín gangan ní èdè abínibí wa.
Kíndìnrín jẹ́ ẹ̀yà ara tí ó ṣe pàtàkì fún ìgbé ayé àlàáfíà tí Ọlọ́run dá síbẹ̀. Bí oníbejì ni gẹ́gẹ́ bí ọ̀pọ̀lọpọ̀ nínú àwọn ẹ̀yà ara wa, ìkan ní apá ọ̀tún, ìkan ní apá òsì. wọ́n wà ní ẹ̀gbẹ́ gogoro ẹ̀yìn wa tá à ń pè ní spinal cord. Ìkọ̀ọ̀kan sì jẹ́ bí ìwọ̀n tá a bá di èṣù ọwọ́ wa. So ìkan lápá ọ̀tún, ìkan lápá òsì. Iṣẹ́ tí wọ́n sì ń ṣe ó jẹ́ iṣẹ́ tí ó pọ̀ lọ́pọ̀lọpọ̀ tí ó sì ní agbára tí a ò lè fojú fò dá.
Ẹ ṣeun gan ni dókítà. What work does the kidney does in the human body? Tí bá ṣe ń ṣàlàyé lédè Gẹ̀ẹ́sì màá ti fẹ́ kẹ́ bá wa ṣàlàyé lédè Yorùbá. Ohun tí mo bèèrè náà ni wípé kí ni iṣẹ́ tí kídìnrín ń ṣe gan ní àgọ́ ara wa? Ẹ bá kọ́kọ́ ṣàlàyé bóyá lédè Gẹ̀ẹ́sì lè máa kọ́kọ́ sọ ní tàbí lédè Yorùbá.
Okay. The kidneys, as said earlier, are very powerful organs. First, they are very super filtrative, functioning like a sieve to remove toxic substances after metabolism and get them excreted. Number two, they are super regulatory to make sure that the body exists in equilibrium. So there are certain things in the body like the sodium, potassium, calcium, and the rest. So the kidney and the fluid as well. The kidney serves to ensure that these substances are in appropriate measures. And when these substances are in their proper measures, they also go a long way to adjusting and ensuring that the blood pressure is okay. And the third thing is that it is also like a production factory where certain hormones are produced to make sure that the individual is okay. And one major production of the kidney is a hormone called erythropoietin that helps in ensuring that there is enough blood in the system. So in summary, we talk about filtration, we talk about balance, we talk about production. So these are very important things that the kidney
does in the human body.
Yeah.
Mo fẹ́ kẹ́ ṣàlàyé náà bẹ́ẹ̀ ṣe sọ lédè Gẹ̀ẹ́sì àwọn túmọ̀ lédè abínibí wa.
Ok, ẹ ṣé. Olóòtú béèrè lọ́wọ́ mi pé iṣẹ́ pàtàkì wo ni kíndìnrín ń ṣe. A sì dáhùn wípé iṣẹ́ kíndìnrín ó ṣe pàtàkì lọ́pọ̀lọpọ̀. Ní alákọ̀ọ́kọ́, ó ń ṣiṣẹ́ fún bí nǹkan tí a bá pè ní asẹ́ tàbí àjọ. A mọ ìwúlò asẹ́ tí a bá jẹ́ ká wo bí àwọn tó ń ṣe ògì, ọ̀pọ̀lọpọ̀ ènìyàn ní kì í jẹ èrí mọ́ ògì. Asẹ́ yìí á jẹ́ kí a yọ ìdọ̀tí kúrò nínú àwọn ohun tí ó wà nínú ara. Torí bí a ṣe ń lọ sókè lọ sódò, ọ̀pọ̀lọpọ̀ ìgbà ni ó jẹ́ pé àwọn nǹkan tí kò bá ara mu ni ara ń ṣe ló ń pèsè. So iṣẹ́ asẹ́ kíndìnrín ni pé kí ó yọ ìdọ̀tí kúrò nínú ẹ̀jẹ̀ àti nínú gbogbo oríkèéríkèé ara wa. Yóò wá kó pọ̀, á di nǹkan tí à ń tọ̀ síta. Ohun kejì tí kíndìnrín tún ń ṣe ni wípé ó ń ṣiṣẹ́ bíi kí nǹkan kí ó wà ní ìwọ̀ntúnwọ̀nsì, so balance. So àwọn èròjà kan wà nínú ẹ̀jẹ̀ àti nínú ara tó jẹ́ wípé iṣẹ́ wọn ni kí a lè wà bí ó ti péye. So kíndìnrín yìí ló ń ràn wá lọ́wọ́ láti jẹ́ kí ó rí bẹ́ẹ̀. Tó bá sì wà ní bó ṣe yẹ kí wọ́n ṣe wà, ọ̀pọ̀lọpọ̀ ìgbà ni ó jẹ́ wípé wọ́n ní ipa tí wọ́n ń kó lórí ìfúnpá ẹ̀dá kó lè wà níbi tí ó yẹ kí ó wà. Ohun kẹta tí kíndìnrín tún ń ṣe ni pé ó dàbí ilé iṣẹ́ tí ó ń ṣe ìpèsè. Kí nìkan náà sì ń pèsè yìí? Ó ní èròjà kan nínú ara tó ṣe pàtó fún ṣíṣe ẹ̀jẹ̀. Òun ni à ń pè ní erythropoietin. Iṣẹ́ kíndìnrín nínú eléyìí kò sì kéré. So ní pàtó ọ̀ ní ṣókí iṣẹ́ kíndìnrín pín sí bí ipa mẹ́ta tí a ti dárúkọ yìí.
Filtration, balance àti protection.
Production
rather. Ẹ dárúkọ nǹkan kan lẹ́ẹ̀kan yẹn, ẹ dárúkọ blood pressure bẹ́ẹ̀ ṣe ń explain. I would like to ask you, does the kidney have anything to do with the blood pressure? If yes, how does it affect it? If no, how does it not affect it?
Yeah, the kidney and the blood pressure, in fact, it's could be both cause and effect. So when the kidney is functioning normally, it helps to maintain or regulate the blood pressure. If, however, an individual has elevated blood pressure and it is not properly taken care of, it can adversarially affect the kidney. So, the kidney, when it is okay, helps in regulating the blood pressure by adjusting the substances that I mentioned earlier. And by the time we get to talk about the things that affect the kidney, blood pressure is also one of the things that, if it is not properly taken care of, can destroy the kidney. So that's why I say when you see kidney is diseased, one of the things that can tell us that the kidney is diseased is that the blood pressure most times are often very elevated and difficult to control. Then poorly controlled blood pressure can destroy the kidney. So we have that mix.
Okay, ẹ bá wa ṣàlàyé lédè abínibí wa.
Ohun tí wọ́n béèrè lọ́wọ́ wa ni wípé kí ni ìbáṣepọ̀ tó wà láàrin ìfúnpá gíga àti kíndìnrín. Ìdáhùn tí a sì ní fún ni wípé kíndìnrín ó kó ipa tí ó ṣe pàtàkì lórí bí ìfúnpá yóò ṣe wà ní ìwọ̀ntún-ìwọ̀n-òsì tá à ń pè ní ìwọ̀ntúnwọ̀nsì. A sì tún sọ wípé kíndìnrín tí ẹnìkan bá ní ìfúnpá gíga tí kò bìkítà lórí ìtọ́jú rẹ̀ tàbí kò gba ìtọ́jú tí ó péye, ìfúnpá tí ó ga lápọ̀jù ó lè ba kíndìnrín jẹ́.
Ẹ ṣeun gan ni dókítà Olalekan Ojo, ìyẹn náà ẹ ti ṣàlàyé yẹn fún wa. Ẹ jẹ́ ká tún lọ mú ìbéèrè mìíràn tí mo tún fẹ́ béèrè lọ́wọ́ yín ni wípé bóyá kí n dẹ̀ kọ́kọ́ béèrè lédè Gẹ̀ẹ́sì. Yeah, what is the current burden of kidney problem in our environment? You know, the local, the national, the global. What exactly is the current burden on this kidney problems?
Kidney problem has assumed a very disturbing epidemiologic proportion globally now. It is estimated that about 850 million individuals have kidney disease. And if we come back to Nigeria, it is estimated that we have about 15 to 20% of the population having a form of kidney disease or the other. And I mean, we don't know the exact population of Nigeria. Some people put it at 260 million and whatever. But so if you look at it, if we say 20% of about 20 to 50 million, you're talking about 50 million population. So it is such a humongous value that is very scary. And that is why there's hardly any day that you go on social media or you're talking about health or people that are looking for assistance one way or the other, you will hear of kidney disease. In fact, it is such a very disturbing thing now. About 2 years ago, our association, now I'm talking about the kidney experts, had to take it to the National Assembly. And the United Nations is seriously looking in the direction of what do we do to take care of it, because a kidney disease sufferer can consume the whole budget that is voted for health. It is very calamitous and could be very difficult to manage. Thank you.
Ẹ ṣeun gan ni dókítà, ṣé ẹ lè tún ṣàlàyé lé bàbá ṣe ń ṣe kó má di pa àmà tún ìbéèrè yẹn bẹ́ẹ̀ ni.
Yes, pé kí ni ipa tí àìsàn kíndìnrín ń kó, báwo ni ìjàmbá rẹ̀ ṣe rí ní ara àwa ènìyàn. A sì sọ wípé kì í ṣe ohun kékeré ni kíní yìí ń dá sílẹ̀ ní ara àwọn ẹ̀dá ní àgbáyé. Ó súnmọ́ bíi bílíọ̀nù kan àwọn ènìyàn tí kíndìnrín ó ń ṣe ìjàmbá fún. Tá a bá sì ní káwọ́ ní orílẹ̀-èdè wa ní Nàìjíríà ní bíi èèyàn 15 sí 20 nínú 100 ènìyàn ni ó ní ìjàmbá kíndìnrín ní ọ̀nà kan tàbí ọ̀nà mìíràn. Tá bá dẹ̀ ní pé kí a tún wo kí ni iṣẹ́ àbí ipa rẹ̀ nínú ìdúnàdúrà àti ìnáwó, a rí wípé bí kí Ọlọ́run má jẹ́ kéèyàn kó rí gbèsè ni. Ó jẹ́ ohun tí ó lágbára púpọ̀ púpọ̀. Nítorí ìdí èyí ni àwa tí ó jẹ́ oníwòsàn ti ìṣègùn ní ipa ti kíndìnrín a láti gbé ẹjọ́ yìí lọ sí àjọ àgbáyé tá à ń pè United Nations. Ní ti Nàìjíríà ní ọdún tó kọjá ní 2024 a lọ sí even National Assembly níbí ní ọdún tó kọjá ní February. A tún wà pẹ̀lú Senate ọdún yìí again a tún ṣì ń lọ bá wọn kí wọ́n lè bá wa dá sí ọ̀rọ̀ yìí, nítorí tí kíndìnrín bá lọ apá ẹ̀dá kan lè má fẹ́ tó, ó sì lè fẹ́ sọ gbogbo ilé di kí wọ́n fẹ́ gbogbo nǹkan tí wọ́n ní kí wọ́n fẹ́ tà láti tọ́jú rẹ̀.
Ẹ ṣeun gan ni dókítà Olalekan ẹ̀kọ́ àtúntònú. Ẹ jẹ́ àtún béèrè ìbéèrè yìí lọ́wọ́ yín, àmọ́ a máa ṣe báyìí, a máa béèrè lédè Gẹ̀ẹ́sì ìdẹ́nà ẹ má bá a túmọ̀ ní èdè abínibí wa. Kí ni àwọn symptoms kó tó di pé àti ẹ̀bọ́ sí nǹkan tó ń fà á gangan? Kí ni àwọn early signs and symptoms tí yàn lè wò pé ó dà pé kíndìnrín ti ní ìṣòro kankan tàbí méjì? The early signs and symptoms of kidney problems.
Okay. Oftentimes, before an individual begins to know, a number of things could have happened. But one of the earliest things that we see starts with the urine. I think we're going to still be talking about the different types. So there are times that the individual might have reduction in urine production, and at other times, it could be an early increase in urine production. That is with respect to volume. Then there could be what we call frothiness of urine. It could be bubbly or foamy. That is that. Then there could be things like the body swelling, oftentimes early morning facial swelling, and as the day goes by, the person sees that when he wakes up, the face is swollen, and then as the day goes by, it regresses, and then it can progress to affect other parts of the body, like the feet, the leg, the tummy, and all the rest like that. Then there could be reduction in appetite of the individual. There could be visual blurring, there could be tiredness, there could be sleep disturbance. And this sleep disturbance is such that during the day, the person might notice that he has excessive somnolence, he feels sleepy. In fact, he might not be able to sustain conversation, and he gets drowsy. And then there's nocturnal insomnia. He doesn't feel like sleeping during the night. Then the other aspect of the symptom is that there could be itchy. The individual would excessive itchiness. He itches the body excessively, and if nothing is done, well, the ability of this individual to, like we said earlier on, it could be drowsy, and it could progress to irrational talk, loss of consciousness, and the rest. Then, in very severe cases, the blood level in the individual could be very low till it's almost not having blood any longer. And then a few instances, yes, we talked about vomiting earlier. Then abnormal bleeding could even be seen in some instances. Some people could be passing very blackish stool and everything like that. But on a general note, we start with the urine, we start about body swelling, we talk about the excessive itchy experience. So, fún àwọn ènìyàn wa tó jẹ́ wípé èdè abínibí ni ó tẹ́ wa lọ́rùn jùlọ. Nǹkan tí olóòtú bí mi léèrè ni wípé báwo ni ẹni tí ó ní àìsàn kíndìnrín ṣe fẹ́ mọ̀ wípé ó ní àìsàn kíndìnrín yìí. ìdáhùn rẹ̀ sì ni wípé ọ̀pọ̀lọpọ̀ ìgbà kí ẹni tó ní àìsàn kíndìnrín kí ó tó mọ̀ nǹkan ti lè bàjẹ́ lọ́pọ̀lọpọ̀. Bóyá kí n sọ báyìí wípé nínú kíndìnrín a ní àwọn kíní kékèké kan tá à ń pè ní tí òyìnbó ń pè ní nephron ní ẹnì kọ̀ọ̀kan sì ní bíi mílíọ̀nù kan. Bí wọ́n ṣe ń dàgbà sí ó ṣeé ṣe kí ìjàmbá wọn bá wọn kí ẹni tó ní àìsàn kíndìnrín kó tó mọ̀ pé nǹkan kan ń ṣẹlẹ̀ ìdajì nínú mílíọ̀nù kan lè kó ti lọ dànù. Kí ni ẹni náà á sì bẹ̀rẹ̀ sí ní rí? Ó lè rí wípé ẹsẹ̀ ń wú, ojú ń wú, ikùn ń wú. Ó lè rí wípé ara ń yún òun jù, oúnjẹ ò ní lọ déédé, àyà lè máa rìn tàbí kí ó máa bì. Tó bá dẹ̀ tún gbìnàyà sí ó lè di wípé kírú ẹni bẹ́ẹ̀ kọ́rọ̀ rẹ̀ fẹ́ máa tàsé lẹ́ẹ̀kọ̀ọ̀kan. A sọ̀rọ̀ nípa àìrí oorun sùn tàbí àsùnjù oorun. Ọ̀sán ó jẹ́ ìgbà tí ọ̀pọ̀lọpọ̀ wa tó jẹ́ pé ìgbà tí à ń ṣiṣẹ́ rẹ̀ irú ẹni bẹ́ẹ̀ lè máa rí pé òun sùn jù lọ́sàn. Alẹ́ tó jẹ́ àkókò tó yẹ kó jẹ́ fún òun á jẹ́ ìgbà tí irú ẹni bẹ́ẹ̀ kàn ń sùn jù. Tí wọ́n bá sì ṣe nǹkan tó yẹ kí wọ́n ṣe lé lórí náà irú ẹni bẹ́ẹ̀ lè wá di ẹni tí ò sọ̀rọ̀ mọ́. Ó lè ṣe gìrì àgbàlagbà. Irú ẹni bẹ́ẹ̀ sì lè gba ibẹ̀ kú. Àwọn kọ̀ọ̀kan wà tó jẹ́ wípé wọ́n á ṣe ẹ̀jẹ̀ tàbí kí wọ́n máa gbé ẹ̀jẹ̀ síta ní ọ̀nà tí a kò retí. Ẹlòmíì lè ní nǹkan tí à ń pè ní bíi ulcer àti oríṣiríṣi nǹkan bẹ́ẹ̀. Rírẹ ni ní ọ̀pọ̀lọpọ̀ ìgbà náà. So gbogbo irú nǹkan bí eléyìí ló máa ń jẹ́ àpẹẹrẹ pé àbí kó jẹ́ bí atọ́ka sí wípé kíndìnrín irú ẹni bẹ́ẹ̀ ó ti ní ìjàmbá.
Ẹ ṣeun gan ni dókítà wa, dókítà Ojo. Mo fẹ́ béèrè lọ́wọ́ yín bẹ́ẹ̀ ṣe sọ àwọn nǹkan tá a lè rí àwọn signs pé àpẹẹrẹ pé ó dà pé kíndìnrín ẹni báyìí tàbí kíndìnrín ẹni náà ti ní ìṣòro. Kí ló wá ń fa àìsàn kíndìnrín gangan yẹn? What are the common causes of kidney injury in our environment?
Okay, thank you very much. Now, on a general note, we have kidney disease divided into two. That is acute kidney injury, that is chronic kidney disease. Acute kidney injury talks about an insult or assault on the kidney that is of a sudden onset, leading to a sudden deterioration in kidney function. So all the substances that the kidney, or all the functions rather, that the kidneys observe would be shut down or deteriorate in an acute setting. So, for instance, when people have diarrhea, in the days of cholera, which we still see in some part of the country, or somebody who has a road traffic accident and all the rest. And in Ondo State here, we have Lassa fever, and is a major cause of acute kidney injury. So now, in all this acute setting, the individual will be okay, and within a matter of hours to days, maximum to some weeks, all those things would acutely insult the kidney. The kidney was okay, but something just happened acutely, including things like bee sting, snake bite, and all the rest. So those ones, and then abnormal use of herbs, all these things can cause acute kidney injury. Now, the major one that we are talking about, I'm not saying that those ones are minor, but we're just saying that there could be acute kidney injury. Now, for the major one, which is the chronic kidney disease, by definition, talks about a progressive deterioration, progressive irreversible deterioration in kidney disease. Now, the individual has this. Now, for the acute kidney injury, it is potentially reversible, especially if we see them early and then we're able to treat. But for chronic kidney disease, it is not reversible. And now, the causes of chronic kidney disease, we talk about poorly controlled hypertension, poorly controlled diabetes mellitus, we talk about some infections like HIV, hepatitis B, maybe hepatitis C. Also, I referred to use of herbs. This one also causes chronic kidney disease. Then there are certain things that individuals are born with, genetic or heredofamilial, things like sickle cell disease. And now we're seeing also some conditions that, for some yet to be fully clarified reasons, body begins to fight self. We call that autoimmunity. You know, immunity talks about the ability of an individual to defend himself against a foreign thing. But in autoimmunity, the body loses ability to recognize self, then begins to produce things that are destroying self. So we have conditions like systemic lupus, erythematosus, rheumatoid arthritis, and all the rest like that. So those are the other causes. And then not forgetting old tuberculosis. Those things also cause kidney disease. Na ká sọ ní Yorùbá, kí ni ó ń fa àìsàn kíndìnrín? Ìdáhùn sí ìbéèrè yìí ni wípé àìsàn kíndìnrín ó pín sí ipa méjì. Alákọ̀ọ́kọ́, àwọn tí ó ṣẹlẹ̀ lójijì bí ìjàmbá tí a kò ronú sí, tí irú ẹni bẹ́ẹ̀ kò sì lérò pé ó lè ṣẹlẹ̀. Ọ̀pọ̀lọpọ̀ ìgbà ni ó jẹ́ pé bí àwọn àrùn onígbá méjì, ó ń bì, ó ń yàgbẹ́. Ẹni tó ń bì tó ń yàgbẹ́, omi ara ló ń ṣe dànù. Tí omi bá dẹ̀ dé ipa kan, ó lè jẹ́ kí kíndìnrín ó sọ iṣẹ́ sílẹ̀. Ẹni tí fún ìdí kan tàbí òmíràn ó bẹ̀rẹ̀ sí ní ṣẹ̀jẹ̀, bóyá yálà níbi ìjàmbá ojú ọ̀nà ni tàbí ibi tí wọ́n ti lọ bímọ, tí ẹ̀jẹ̀ yìí bá ya tó dẹ̀ pọ̀ jù, àwọn ẹ̀yà ara kan wọ́n á kàn sọṣẹ́ sílẹ̀. Àwọn ẹ̀yà ara bíi kíndìnrín náà dẹ̀ ni ó kọ́kọ́ máa ń fà. Àwọn èèyàn kan náà wà tó jẹ́ wípé pàápàá jùlọ àwọn èèyàn tó jẹ́ wípé kò sóògùn tán lè lò. Àgbo ni o tàbí àkàpọ̀. Tá a bá lọ sí tẹ́ bá lọ sí chemist máa ń pẹ́ ẹ̀kàpọ̀, wọ́n lè fún ọ ní ibuprofen, Fensic, butazolidine, and then they put everything together. Gbogbo orú nǹkan báyìí ló máa ń fa àìsàn kíndìnrín àti àwọn kòkòrò àìfojúrí kan. Pàápàá nípínlẹ̀ Ondo wa yìí, à ń sọ̀rọ̀ nípa ibà ọ̀rẹ̀rẹ̀ ti Lassa fever. Fún àwọn tí ó ní ibà Lassa fever, pẹ̀lú àyẹ̀wò tí a ṣe ní ilé ìṣègùn wa, èèyàn bíi ìdá kan nínú 4 tó bá ní ibà ọ̀rẹ̀rẹ̀ Lassa yìí ló ní ti kékeré ní ti pàjáwìrì tá à ń pè ní acute kidney injury. Àmọ́ bàbá rẹ̀ ní ti àìsàn kíndìnrín ti eléyìí tí ó jẹ́ wípé ó ń pẹ́ títí ayé tá à ń pè ní chronic kidney disease. Àwọn nǹkan tí ó ń fà á náà ni alákọ̀ọ́kọ́, ìfúnpá gíga tí a kò mójútó bí ó ṣe yẹ. Ẹlẹ́ẹ̀kejì ni àìsàn ìtọ̀ ṣúgà tá à ń pè ní diabetes tí ìtọ́jú rẹ̀ kò bá péye. A ti sọ̀rọ̀ nípa àwọn àrùn kọ̀ọ̀kan, pàápàá jùlọ àrùn kògbóògùn tá à ń pè ní HIV. Ó máa ń jẹ́ kí kíndìnrín lè ní ìjàmbá, yálà nítorí pé ó ti pẹ́ lára ni tàbí nítorí pé ẹni bẹ́ẹ̀ kò gba ìtọ́jú tí ó péye. Àwọn nǹkan mìíràn náà tó sì tún fa àìsàn kíndìnrín, a ti sọ̀rọ̀ nípa oògùn ìlòkulò lẹ́ẹ̀kan. Ó wà lára nǹkan tó lè fà kó ṣẹlẹ̀ bẹ́ẹ̀ ní ọ̀nà pípẹ́. Another one ni àwọn àìsàn tí a bí àwọn ènìyàn kan mọ́. Àìsàn bíi àrùn rọmọlápá rọmọlẹ́sẹ̀ tí à ń pè ní sickle cell disease. A sì tún ní àwọn kan náà tó jẹ́ pé àjogúnbá ni. Àwọn ẹbí kan nínú ilé wọn, wọ́n ní àwọn kan tá à ń pè ní cyst nínú kíndìnrín. So ó ṣe é ṣe kó rí bẹ́ẹ̀. Àwọn kan tó tún dàbí àìsàn kògbóògùn HIV, hepatitis B, hepatitis C náà, òun náà tún lè rí bẹ́ẹ̀. A sì tún wá sọ wípé a bẹ̀rẹ̀ sí ní rí ní ẹnujọ́ mẹ́ta yìí bóyá torí pé ìmọ̀ ti dàgbà sí ni o fún ìdí kan àbí òmíràn kí ara máa ṣàdédé bá ara ẹ̀ jà nǹkan tó yẹ kó máa tọ́jú torí àmọ́ bí irú nísìn tí landlord bá wà nínú ilé ọ̀pọ̀lọpọ̀ ìgbà la máa ń gba ọlọ́dẹ iṣẹ́ ọlọ́dẹ ni pé kó má jẹ́ kí ìjàmbá ó wọnú ilé kó sì jẹ́ kí nǹkan tó wà nínú ilé kó máa gbé nínú ilé bọ́ fún ìdí kan tí a ò tí ì mọ̀ lẹ́kùnrẹ́rẹ́ nǹkan tó yẹ kó máa ṣe bíi adínàgbòkú fún ìjàmbá láti wọlé ó wá kúkú kó ìjàmbá yìí bẹ̀rẹ̀ sí ní àtáàkì ara kíndìnrín sì jẹ́ nìkan nínú àwọn nǹkan tí ó máa ń ṣe ìjàmbá fún so àwọn ọ̀pọ̀lọpọ̀ nǹkan tó ń fa àìsàn kíndìnrín ni a ti sọ ní ṣókí.
ẹ ṣeun gan ni dókítà wa mo lérò pé àwọn aráalé wọn ń kàn nǹkan torí àwa gan nínú ilé agbára ń bì náà à ń kàn nǹkan méjì tàbí mẹ́ta kan nínú tí ẹ ti sọ ẹ dárúkọ àgbo lẹ́ẹ̀kan mo fẹ́ béèrè lọ́wọ́ yín torí a rí àwọn kan tí bóyá láti kékeré àwọn tó ti máa wọ bíi 50, 60, 70 bẹ́yẹn láti 50 ṣá adé láwọn kan ní age range yẹn tí wọn ò ní kidney disease kankan adé láwọn kan tí bóyá wọ́n ní ṣe fẹ́ wá ṣàlè link ẹ̀ mọ́ torí most of láyé àtijọ́ kò sẹ́ni tí wọ́n máa sọ pé kò sọmọ tó bá bí ní ilẹ̀ Yorùbá tí wọ́n ní fi àgbo wẹ̀ tí wọ́n ní fún ní àgbo mu and ara àwọn kan tó wà òkè ní age range tí mo sọ adẹ̀rẹ̀ àwọn kan tí ó mo wá fẹ́ béèrè lọ́wọ́ yín pé ṣé àgbo yìí ṣó ní nǹkan kan ṣe pẹ̀lú nǹkan tó ń ṣe kídìnrín tó wọ́n affect àwọn èèyàn ní old age ní láti ní láti 50 lọ 60, 70 tàbí àwọn ọmọ kéékèèké náà tó rárá àwọn ọmọ kéékèèké kan tó máa ní ẹ máa rí issues wọn ní àwọn ọmọ kékeré kan wọ́n ní kidney problems ṣé a fẹ́ sọ pé àgbo yìí ló ń fa ni àbí kí ni mo fẹ́ kẹ́ ṣàlàyé bẹ́ẹ̀ torí misconceptions ń trail the use of herbs pẹ̀lú in relation to kidney disease.
Thank you very much. In fact, let me even quickly say that there were two major issues that we did not refer to when we were talking about chronic kidney disease. In children, especially the male, we talk about there are some congenital anomalies that, for instance, in boys, there's what we call the posterior urethral valve that blocks or prevents urine from going as it should be. And, if you imagine the urinary tract as a pipe, you can imagine if there's a blockade somewhere. It's just like around your compound, there are gutters. And then for one reason or the other, something obstructs or blocks the gutter. What do you have? Accumulation of water, and then it becomes smelly. So that is one of the other things that we see, especially in children. And is a major cause of chronic kidney disease. And then in people, especially the male adults, prostate enlargement causes chronic. So we talk about bladder outlet obstruction, and then of course, cancers. All those things do happen. Now, to your question about the interaction between herbs and the kidney, we are not knocking herbs, as it were. But you see, there are peculiarities of different environments, and you will agree with me that we are highly secretive in this part of the globe. In fact, a number of people, I know children that don't know the health status of their parents. You say, your dad is late. What killed the father? He doesn't know. You understand what we're trying to say? So, now that is one aspect of it. The other aspect of it is the fact that there are some of these things that work. But please, for instance, you have a 3-year-old who has malaria, and the doctor who sees children, pediatrician, will tell you, take this medication. But how is it to be taken? You might say, maybe take half a tablet, half a teaspoon, and everything like that. That is what we call regulation. We've seen the interaction between the medication and the body system, that if you exceed a particular limit, you know that it can be deleterious. Because the truth of the matter is that every medication is a potential poison. Now, in our own environment, there is this abuse associated with these substances, such that you say, I don't want to refer specifically to any agent, that look, if you take this, it will be okay. But what quantity should be taken? We don't know. And then we have a lot of people that are just masters without undergoing any tutelage. You see a girl who did not have anything to do, she just packs everything, in a particular whatever. Now, what is the environment for the preparation like? How is it preserved? There are certain, for instance, alcohol is a non preservative. If you put something in alcohol, it might last longer than just putting it in water. Now, so many already, we don't even know how some things are done. So we believe that this lack of one allowing scientific analysis to go into some of the things that we are doing is one major issue. 2, the environment. 3, abnormal mixture. 4, not allowing scientific input. Because I was talking to some individuals recently, and that is the truth. Up till about 15, 20 years ago, we know the medication that we're using to treat malaria. But our counterparts in China, they're promoters of herbs. And they were able to look at a particular tree and they saw that this thing, okay, it can take care of malaria. Further research was done into it. The herbs were extracted, refined, and then particular measures where it's okay, if you take this level, it would take care of this thing. Our own people are not really that open to what we are talking about. And like we said, don't forget, we said one of the number one functions of the kidney is what? Filtrative. Now, if you now jam the filtrating organ with things that are potentially toxic, it will die. So, if I'm to take a particular medication for malaria now, I think they will say, okay, for instance, they say, take 3 tablets at once. That is for me. But for my baby, who is 6 months, it might take the same, but say it will take like maybe 15% of what I have taken, and it will be okay. But if ours is just blanket like that, yes, you can kill the malaria and kill the baby. So those are some of the issues that we are talking about. And then in fact, everything is regulation. Our practices, including some of the things we use in this part of the world, we use too many chemicals. And that is why I don't know if you have observed that a number of agricultural products are not allowed into the West because the levels of the herbicides, pesticides that are used, they said they are not okay for human consumption. Could it be the reason why? We're not just knocking herbs, as it were, but it's a combination of some of these things that we believe are responsible for what we're talking about. And then I said something about the Chinese people. Now, we're not giving a blanket approval to everything coming from China. If you Google, there is what is called Chinese herbs nephropathy. Of course, the agent in the Chinese herbs is aristolochic acid. Again, they've allowed us access, so we know that. So and Chinese herbs causes a form of chronic kidney disease that will cause subacute interstitial nephritis and everything like that. So we have that. So we need to ensure regulation. Let us be open. And I know that if we do this, we will get there because there are many herbs, but you can't just be going for herbs anyhow. Otherwise, you have many dead people before we achieve what we have in mind. So nǹkan tí olóòtú bí wá léèrè lẹ́ẹ̀kan sí ni wípé kí ni ìbáṣepọ̀ tí ó wà láàrin àgbo àti àìsàn kíndìnrín. Nǹkan tí a sì sọ ni wípé kì í ṣe wípé à ń sọ wípé gbogbo nǹkan tiwa náà ni ò dáa, àmọ́ ẹ jẹ́ kí a mọ kí ni ìwọ̀n nǹkan tí à ń ṣe yìí. Ẹ jẹ́ ká fi ọgbọ́n òde òní sí ká jẹ́ wọ́n ní ọ̀tún wẹ òsì, òsì wẹ ọ̀tún, ká fọwọ́ wẹwọ́ lọ́wọ́ fi mọ́. Nǹkan tí ẹ ti mọ̀ tẹ́lẹ̀, ẹ jẹ́ ká tún lọ síwájú sí. Kí ló wà nínú àgbo yìí? Kí ni a fi lè ṣe dáadáa? Ọ̀pọ̀lọpọ̀ ìgbà ló jẹ́ pé ó lè jẹ́ pé ká sè é ló máa jẹ́ kí nǹkan tí ó lágbára nínú ẹ̀ kó lè ṣe dáadáa, tàbí kó jẹ́ pé omi tútù ni. Nǹkan mìíràn tó jẹ́ pé bí alcohol ló máa mú dára. Àmọ́ ó sì yẹ ká mọ̀ pé ọmọ ọdún kan àti ọmọ ọdún 12 kì í ṣe nǹkan kan náà ló yẹ káwọn méjèèjì ó jọ lò. Tẹ́ bá sì lọ sí àárín ọjà wa ní ìsìn, arábìnrin kan yóò gbé kinní sórí, alẹ́, àfàtọ̀, ọ̀pá ẹ̀yìn, kí ló wà nínú ẹ̀? Àmọ́ a sì rí pé ọ̀pọ̀lọpọ̀ àwọn èèyàn wa ló jẹ́ pé tán bá ti mu kinní fún ó ṣe ìwọ̀n ìgbà díẹ̀ báyìí nísìn, kíndìnrín wọn tún ti lọ. So ó yẹ ká mọ̀, ẹ jẹ́ ká sowọ́pọ̀ ká lè mọ nǹkan tí ó ń lọ. Àmọ́ kó tó di ìgbà tí a fi mọ nǹkan tó wà nínú àwọn kinní, ẹ jẹ́ ká bìlà sẹ́yìn fún àwọn nǹkan tí ó lè fa ìjàmbá, torí a ti rí pé ọ̀pọ̀lọpọ̀ ìgbà kinní ń fa ìjàmbá sára.
Ẹ ṣeun gan ni dókítà, kódà ẹ ti ṣàlàyé dáadáa fún wa. Àmọ́ on a very lighter note ní kòkòrò láì tún fàágùn jìnnà. Àwọn àgbo tẹ̀ ń sọ yìí náà, àwọn kan mú tó dẹ̀ ń ṣiṣẹ́ fún wọn. Ṣé tẹ̀ ń sọ ni pé ó lè ṣiṣẹ́ kó tún pa wọ́n lára?
Bẹ́ẹ̀ni. Ṣé bí ní ìsìn à ń
kó
sọ̀rọ̀.
tún pa kíndìnrín lára.
Bẹ́ẹ̀ni.
But àmọ́ á ṣiṣẹ́ fún àkókò yẹn.
Àmì ó náà ni tíṣẹ́ bá ti ṣe iṣẹ́ àṣejù. Even tí a bá ra epo sínú mọ́tò tí kinní ṣé valve náà ń pè tó bá ṣí, á lọ overfloat. Kò ń ṣe pé òṣèpò ń bẹ̀, kì í ṣe pópó òṣìṣẹ́. Ó ti overfloat, ó ti pọ̀ jù ni, ó dẹ̀ tún ó sápá ọkọ̀ náà lórí. Mechanic gbọ́dọ̀ débẹ̀. So tá a bá ti lò jù, ẹni tó lò fún ara ríro tó tún wá dákú lẹ́yìn àtọ́rọ̀ ṣe ti bọ̀rọ̀ jẹ́.
Ó dáa ajá dátọ́mì ajádókè lọ àápadà bọ̀ ètò ìlera dára náà lè ṣe ń gbọ́ lórí ìkànnì alálùbáríkà Glo 99.1 FM pẹ̀lú ìbáṣepọ̀ Nigerian Medical Association ti ìpínlẹ̀ Ondo ń bí. Glo Health Talk with NMA, Nigerian Medical Association Ondo State Chapter. And we're looking at this topic today in case you're just joining us, reducing the burden of chronic kidney disease. And we've asked our guest a whole lot of questions, and he has done justice to those questions both in English and Yoruba. We'd also like to ask you, sir, how do we reduce the burden of chronic kidney injury? The steps at individual level, at the level of the medical association or professional group, or even the government policy?
Okay. Well, at the individual level, our recommendation is that take responsibility for your health. Know your numbers, like we often say. We said the other time that one major cause of chronic kidney disease is hypertension. The interesting thing about hypertension is that it is most times without symptoms. So somebody might be carrying very severe hypertension about, and he would not know until something major is damaged. So let us avail ourselves the opportunity of knowing what is your blood pressure, what is your sugar level. And for those who already know and are undergoing treatment, please keep on with what the recommendation is. Let us avoid abuses to the best of our ability. Follow your prescription. That is at the individual level. At the health workers level, what we recommend is that we prioritize screening. Screening helps us to know those ones who already have the condition but did not know. And then we can, intervene appropriately. And, well, we're talking to ourselves. What you are not trained to do, let us avoid dabbling into. And then at the government level, we want to encourage the government to vote more into the issue of health. the budgetary allocation to health is low. And we have a peculiarity in Nigeria, this era of Japa. Please let us keep the health workers within the country. Because the places that a number of people are going to, even in Africa, are much poorer, significantly poorer than Nigeria. Yet those people, they place a lot of premium on health, and that is why they've been able to attract the best brains. And then, with respect to kidney health, let the care be subsidized. An individual who has chronic kidney disease, because it is graded, we have the early and advanced stage. The advanced stages, we offer dialysis. Dialysis is two types. We have hemo and peritoneal dialysis. Now, let's look at hemodialysis. On the average, a session is about 50,000-60,000. And the individual is encouraged to do 3 sessions per week. So let's take the lower 50,000, 3 times per week, 150,000, 4 weeks in a month.
That's 600.
600,000. How many people are earning a fraction of 600? And that is why it makes it to look like kidney disease is death sentence. I mean, I've seen people say, well, if that is it, let him go and die. It is not because they wish to die, but it is because they can't afford it. Minimum wage is 80,000 or 70,000, sorry. Now, that 70,000, he should be able to go to work, to rent accommodation, take care of himself and everything there. Now, kidney is saying, give me this total amount at once. It's very serious. It is catastrophic. But when we vote a lot and then we allow health insurance to take care of some of these things, so at the government level, we can do this thing. And then, of course, encourage, like we said earlier, people to go to, and because even for kidney transplant, the current cost is between 27 and 30 something million naira. So how many people can afford that?
And very quickly, let me ask, is there like a permanent cure for this disease? If at all someone has it and intends to go, is there a permanent cure for it?
For chronic kidney disease, transplant is a way out. But before transplant, we have dialysis. So, and all these are available in Nigeria. Kidney transplant has been with us in Nigeria since 2000, and the government hospitals since 2002.
And has it been working out? Do we have testimonials of persons who have undergone this treatment in Nigeria and are doing fine?
Yeah. I mean, people are dialyzing. Even in Ondo State, we have dialysis. We don't have kidney transplant being carried out in Ondo State as yet. We hope to get there very soon. But we have it being done around, Ekiti, Lagos, Abuja, and all those.
So that's a call to action to endorse the government to do the needful in terms of that.
Yes, thank you.
Okay. Àkókò tí tó fún yàrá lè láti darapọ̀ mọ́ wa bá ṣe máa bèrè nítorí tá a bá ní ká máa bèrè lọ mọ́ máa ti ṣojú òpó yẹn lẹ̀ ká lè kọ́ ẹ̀kọ́ dáadáa tó mọ̀ pé àwọn èèyàn fẹ́ máa pè wọlé tá a bá ti ṣojú òpó láti ṣojú òpó lẹ̀ báyìí your numbers náà tẹ́ máa pè ní 0805-551-1110 máa pè lẹ́ẹ̀kan sí 0805-551-1110 tàbí 0706-677-1822 0706-677-1822. Ẹ má gbàgbé pé a wà lórí Facebook náà ẹ̀yọ ayárabíàṣá Glow 99.1 FM Àkúrẹ́ náà ni ẹ lè comment ẹ lè drop comment yín lábẹ́ live streaming session. Dókítà Ojo ẹ jẹ́ n tún béèrè eléyìí lọ́wọ́ yín. What can be done, in terms of care for someone who already has kidney injury and as such treatment facilities? Okay, you've mentioned it that we have it available. Are they affordable and accessible locally? Yes, you have to answer this question.
Yes.
And
available, yes.
Accessible,
yes.
How do
affordable? I can't.
Okay, so let's bring in government intervention. What do you think the government can do?
No, we've been on this at least prior to about 4 years ago, we really did not have any policy, but at least now the health insurance is coming. And please, I must commend the Ondo State Health Insurance Scheme. I'm not sure of many places in the country where you have the health insurance coming in like we do. So we will recommend the Ondo State policy, while we will also ask Ondo State to up their game. I mean, they are doing well in terms of this. So the government can subsidize, like we said. We can have more centers. Only that if we have more centers, who are the people that would take care of those more centers? Because the kidney experts are very, very, very few in Ondo State. We are not up to 10. Are we up to 5?
In the whole of Ondo State?
Yes, please.
So what's the call to action?
Yeah, we've said it earlier. The government to keep the people to show the passion, and subsidy and encouragement.
All right. Thank you very much. I don't know what's happening with the phone lines this morning, but we have it open. Okay. Let's see if we have some messages on our WhatsApp. But then do well to call us. Those who try to reach us and unable to, please keep trying. We don't know what's wrong with the network today. All right, we have another call. Your parting words, your advice to Nigerians to have healthy kidneys. And I'd like you to also say this in your artist or lady guess it to put Eja say they are binibi wa.
Bóyá ká jẹ́ kúkú bẹ́ẹ̀ lórí èdè àbínibí lọ́tẹ̀ sódà nítorí a lè sọ̀rọ̀ lórí ìbò ká gbàgbé pé.
Bẹ́ẹ̀ ni ẹ má jẹ́ gbàgbé èdè ẹ jẹ́ ká sọ lédè àbínibí wa. Kí ni àwọn alẹ́ nìkan tó ń pè wá lọ́wọ́ ó dà pé ojú òpó yẹn ti dá. Hello, ẹ káàárọ̀. Hello, good morning.
Hello.
Hello, we can hear you, ẹ káàárọ̀.
Hello.
Hello, you're live. Good morning. Can you hear us? Ẹ káàárọ̀.
Mo kí ẹ káàárọ̀ sá o.
Ẹ ṣé sà.
Ṣé rí kí ní problem tó lágbára ni. Ṣùgbọ́n bẹ́ẹ̀ ṣe ń la àwọn ará ìlú lọ́yẹ̀ẹ́, mo dúpẹ́ lọ́wọ́ gidigidi, olúwa pẹ̀lú yín. Ṣùgbọ́n ọ̀rọ̀ tí ẹ fẹ́ sọ ni pé kí la lè fi stop ẹ̀yìn Nàìjíríà àwọn tó máa ń ta àgbo bẹ́ẹ̀ pé kò sí measurement kò sí anything yẹn bẹ̀. Another question ló fẹ́ sọ ni pé àwọn yunifásitì wa tó ń train ní doctors wọ́n máa gba exam malpractice láàyè tó jẹ́ pé àwọn doctors tó ń produce wọn wà up to standard kí la lè ṣe ń pa ìyẹn. God bless Glo FM.
Amen.
God bless Ondo State. God bless Nigeria.
Amen.
My name is Mr. Olu from Okejebo, Akure.
All right, many thanks, Mr. Olu from Okejebo. Thank you very much. We wish you same.
Alákọ̀ọ́kọ́ ti báwo la ṣe fẹ́ regulate àgbo. Yorùbá ní pé tí òǹtà ò bá ta ọ̀rà ò ní rà. Táwa fúnra wa tá bá ti ní ìdánilẹ́kọ̀ọ́ tó péye wípé kíní yóò máa dáa fara tá a bá ra ẹni tó ń ta náà ò ní ta mọ́. So ìyẹn at least tá a bá tiẹ̀ lè arrest àwọn tó ń ta tá a bá rà lọ́wọ́ wọn ò ní ta mọ́. Láti mọ̀ pé kíní yóò dáa fún mi tí n bá ti rà ẹni tó ń ta náà á lọ gbégbá sílé á fi sílẹ̀ kò ní rí bẹ́ẹ̀ mọ́. Ẹlẹ́ẹ̀kejì ẹ ní pé àwọn tí à ń produce ó dàbí ẹni wípé kò rí bẹ́ẹ̀ rárá àti rárá nítorí yàtọ̀ sí pé à ń jẹ́ onímọ̀ ìṣègùn à ń kọ́ àwọn èèyàn náà lẹ́kọ̀ọ́ àmọ́ kẹ́ tó sọ pé ẹnìkan ò ṣe dáadáa bí mo ṣe sọ lẹ́ẹ̀kan ní gbogbo Ondo State yìí gbogbo àwa àti ẹni tó tọ́jú àgbàlagbà àti ẹni tó tọ́jú ọmọ kékeré tó sì dángájá lórí ọ̀rọ̀ kíndìnrín á jẹ́ márùn ni gbogbo wa. So tí èèyàn a dẹ̀ sọ pé èèyàn bíi 20% nàka dẹ̀ sọ pé 10% tó bá dá ṣùrùbù èèyàn bíi márùn iṣẹ́ mélòó ló fẹ́ ṣe kò rí bẹ́ẹ̀. À ń bára wa sọ̀rọ̀ a sì ń wò ó pé ok bẹ́ẹ̀ ká ṣe bí èlé àmọ́ tí even the best of driver tó bá wa mọ́tò fún wákàtí mẹ́rìnlá ó lè kọlu gbòógì yẹ pé kò mọ mọ́tò wa ó ní bó ṣe jẹ́ ó ti rẹ̀ ó dẹ̀ sí níbo so torí kéèyàn tó jáde ní ilé ìwé ìṣègùn yálà fẹ́ di dókítà ni àbí ti nọ́ọ̀sì àbí nǹkan kan á ṣèdánwò àmọ́ nígbà tó bá wá tẹ̀ wá sọ pé òkè mi ò mo fẹ́ sínlẹ̀ bàbá mi ò mo fẹ́ dúró síbi ẹni tó yẹ kí ó tọ́jú èèyàn bíi mẹ́rin bó ṣe ń ṣẹlẹ̀ nílò ìbò tẹ́ni kó tọ́jú èèyàn 40 àgbà tó bá dé level kan ó lè ṣe ọ̀rọ̀ sọ tóun gan ò ní mọ̀
àti rí yẹn manpower bẹ́ẹ̀. Okay, àkókò tí kò wà ní pápámọ́ra ò ní rí jù báyìí lọ. Very quickly, kí ni nǹkan tá a lè ṣe kalẹ̀ maintain healthy kidney wa? Àwa tí nǹkan kan tí ṣe àbáwọn tó ti ń rí symptoms, kí la lè ṣe láti correct láti ní healthy kidney?
Okay.
In just few seconds.
Okay. Let me get over in Yoruba so that I'm a parí ẹ̀sùn.
Yorùbá náà ní kẹfì sẹ́ má sọ lédè Gẹ̀ẹ́sì rárá.
Ó dáa. Ọ̀pọ̀lọpọ̀ ìgbà ló jẹ́ pé àwọn èèyàn kan sọ̀rọ̀ àwọn òkè pé àti mo ṣe ń wò bí ele ẹnìkan sọ fún mi mi ò dẹ̀ dé hospital rí o mo ní mọ́tò lẹ gbé wá ṣé ó lọ ọ̀dọ̀ mẹkáníìkì rí ó ní bẹ́ẹ̀ ni so mọ́tò yín ò knock kẹ́ tó gbé lọ ọ̀dọ̀ mẹkáníìkì so kò yẹ kí kídìní wa ó knock káwa náà tó lọ ọ̀dọ̀ dókítà ẹ jẹ́ kí a lọ máa mọ torí tó rò pé ara òun le ó dẹ̀ lè burú jù bẹ́ẹ̀ lọ so ẹ jẹ́ ká tọ́jú ara wa ẹ jẹ́ ká mọ ipò báwo ni kíndìnrín mi ṣe rí báwo ni ìfúnpá mi ṣe rí báwo ni ọ̀rọ̀ ìtọ̀ ṣúgà àti gbogbo ẹ̀ ṣe rí a ti sọ̀rọ̀ nípa ti alágbòde àti bẹ́ẹ̀ bẹ́ẹ̀ oògùn tí dókítà prescribe orí ń fọ́ lágbájá wọn fún lóògùn bí eléko mí pé kankan náà ló ń fa orí fífọ́ fẹ́ lómi.
Ẹ ṣeun gan ni dókítà Olalekan Ojo tábà ní ká fi yín sílẹ̀ mọ̀ pé máa kọ́ wa títí di aago 10 lónìí a ò ní rí ju báyìí lọ apẹ́ pàtàkì lọ́wọ́ executive producer wa dókítà Ezekiel Akande àti producer wa dókítà Kọmọláfẹ́ àti apẹ́ pàtàkì lọ́wọ́ ẹ̀yin dókítà Olalekan Ojo tá a pè yín tẹ̀dẹ̀ wá consultant nephrologist Federal Medical Center ìpínlẹ̀ tìlú Ọ̀wọ̀ ẹ ṣeun gan ni tẹ́ wá sórí ètò.
Ẹ ṣe olóòtú.
Orúkọ tèmi ni Comfort